I wanted today I'm talking about the lessons from the field. This has been, by the way, an amazing opportunity for me to reflect back to a long time ago, and myself as an early in my life as a gerontologist all the way up to now. And I start out with, I could get this to work. Why is it not advancing? There we go. They say that if you meet a gerontologist, somewhere behind them are these amazing grandparents. And so I need to honor these folks who are my grandparents. This is on left side is my grandma, Celia Cohen. And then my other grandparents, my mom's mom and dad, Elizabeth Betty and Leo Cashin. My grandfather died when I was pretty young, which is not uncommon. I think he died when I was about 8. So I have a few memories of him. One of which I'm going to share. But anyway, and then both my Nana and my grandma were very, very different people. My grandma, she worked at wrapping presents at a department store in downtown Boston. And my Nana was a stay-at-home mom and stayed at home when she was very young. She cleaned. I mean, she was a cook at these fancy people's houses in Boston. But so as you can tell, I came from very affluent means. Okay. So those are my grandparents, and I learned so much from both of my grandmothers. Okay, so I thought what I would do for today is talk about different jobs that I've had. By the way, that is not me. Stock footage. Okay, talk about different jobs that I had, what they were all about, at least one experience from that job, and then the lessons that I learned from that experience. Okay, so my first job in gerontology, I was a homemaker for a home care agency in the summer between high school and college. So that would have been 1979. Okay, so that was the job. And then my job as a homemaker was to clean older adults' houses. I got so much out of that job. It was really my first non-professional job in gerontology. But what I would do is before I cleaned people's houses, while I was cleaning their houses, and after I cleaned their houses, I would talk with them. And I met some of the most amazing people through that process. And I learned so much from them. And what I thought was that our country has this amazing untapped resource. These people were sitting in their houses. I was very blessed to have them share their knowledge with me, but I realized that so many other people could receive so much from the wisdom that they had. And I decided that I was going to devote my life to tapping into that our nation's greatest untapped national resource, the older adults. And that's what I decided to do. I was 17 or 18 years old. It was 1979, 45 years ago. And just to get to the end of the beginning, I did do that. So lesson number 1, older adults are our country's greatest untapped resource, which means that if you're not an older adult yet, someday you will be, and you are an untapped resource. So let's change that. This is the next job that I want to talk about. By the way, 45 years, right? There's a lot I'm not going to share. And then in 1980, I had a job, but I'm picking some stuff. Okay, so I was a nurse's aide at Mattapan Chronic Disease Hospital. My grandpa, who you saw in the earlier photo, he was actually in the 1950s a patient there because he had gotten tuberculosis, and he was there for about a year. So what an amazing thing that many years later, I got to work there as a nurse's aide. And it was the same building, and people still were there for kind of long-term. I would think it's kind of like high-level nursing home care, like things that you couldn't do in a nursing home. So they were at the chronic disease hospital. But I wanted to talk about experiences with two of the folks that were patients there. I guess we call them patients. I prefer to call them residents. But anyway, the first one is Mrs. Washington. And Mrs. Washington was a person who had had meningitis, and she had no short or long-term memory. So she did not know where she was or who she was. And yet every day when I would go in to see her, she would say good morning to me. She would have a smile on her face. She was in an amazing, good mood every single day. And finally, one day I asked her, Mrs. Washington, how is it that you don't know who you are or where you are, but you're always so happy? And she said, well, no matter where I go, no matter what I do, the Lord is always with me. And I have to tell you that my lesson there was to always keep the faith. So this was, I know that this was a job that I had about 40 years ago. And for the last 40 years, I will tell you, Mrs. Washington changed my life, because I always knew that there was a God, because she had told me that. And I know we're supposed to be professional, but this is one of the pieces of wisdom that's just changed my life. And I think about how many people would look at Mrs. Washington and see her as somebody who had almost no value to our world. Right? She was there. She was probably on Medicaid. I don't know, but I never saw a family visit her. Like, according to the things that we tend to prioritize in our society, that woman would have very little value. And yet I could tell you right now, that woman changed my life. Standing here right now, many, many, many times I have thought of her and the fact that I needed to have faith because God existed. And that was a gift I was given when I was 22, I think, 21 or 22. Yeah. I wanted to share about another story because it's so funny. This was one of my first jobs, and I got so much out of it. But I had another woman, and I apologize, I do not remember her name, but there was another woman, and she had dementia, pretty far advanced. And also she was hearing impaired. And the only way to speak to her, because she didn't have hearing aids, was to yell in her ear, literally yell in her ear. But then you could sometimes get a response. And what I learned was that there had been a fire in her home when she was a child. And she lived in that fire. Like that was where she was every day. When she would wake up, she would be in that fire. And if you think about how frightening that must have been for her. And so I knew that this was true for her because she described it to me in very vivid detail. And but in order to have this conversation with her, it required a lot. And what I noticed was that other folks that were working there, I mean, I was a nurse's aide, I just was at the very bottom of this hierarchy, which is another thing we'll talk about. But anyway, you had to scream in her ear and they wouldn't do it. They would just move her. They would say it and I don't think they really knew. And I remember saying to someone, she thinks she's in a fire. And they just really didn't want to listen to what the 22-year-old little nurse's aide had to say. I guess I don't blame them, but anyway, what I learned from that was go to other people's worlds where they are. If you have somebody who has dementia who is not here, why do we expect them to come to us? They are the ones that have this challenge. And to them, we're the crazy ones when we try and say, no, you're in a hospital room. Like, go there. We're well, we can do that. Go to where people are, go to their world and talk to them there, rather than trying to bring them to ours. That was a really good lesson for me, and one that I was very blessed to have had it very early on in my career. My first professional job, and I use quotes, I don't know why. Anyway, I was the director of this organization called Life, Living is for the Elderly, which is so funny because I never use the term elderly and I hate it. I just really think it's so disrespectful. But it was an organization that did advocacy work for nursing home residents. And in that, we would have these monthly meetings that I would meet with the residents, and they would all come from different facilities. It was I was in Boston at the time, and I worked in Dorchester and Roxbury, which are kind of challenging neighborhoods. And we would get vans and buses and whatever, and people would come to these meetings. And my job was to like get speakers and do and have them do presentations. And I always picked the speakers that I thought were good and helpful. Like sometimes in election season, we would get, some of the local politicians to speak, but it was always people that I thought would be interesting for them. So what I realized was I never asked the residents themselves what they wanted. I never asked what kind of speakers would you all like to have, but I thought I was doing a great job because I was picking these people that I thought, when a politician would come, I would feel like I'd really accomplished something, and I would watch the residents listen, and they would be. Here's the lesson. Be an advocate rather than an activist. And the idea is an advocate finds out what people want and helps them to prioritize, and then helps them to get those things. An activist says we need to change. That's very, very me-centric, as opposed to an advocate that is very client-centered. And that was the thing that I learned from that, is that really to do my job effectively, I need to be an advocate. I need to listen to people. I think in some ways I really failed at that job, but I can't help but feel, I was in my early 20s and I had this directorship. Like I thought, oh, I'm so big and smart. Oh my God, I was not. I had so much to learn, but luckily the older adults in my life were very gentle in their teaching. So I'm very glad for that. I was a case manager for the Council on Aging for Southeastern Vermont. So I left Boston and I moved to Vermont. I really loved that job. One of the job was basically to sit in people's living rooms and kitchens, which I loved, and talk to them about what was going on in their lives, where their challenges were, and then help people to get the services that they needed. So I knew about the services that were out there. They knew what their problems were. And so I would try and help them to prioritize and then to link them with the services. Sometimes people didn't want things that I thought they should have. SNAP is a really good example. So a lot of older adults, that they didn't want to have to go through the process of opening up everything about their lives financially in order to receive $67 in food stamps a month. They just didn't. And you know what? I'm an advocate now, right? Because I had this great lesson from the previous job. So what I learned was you help people at what they want you to help them with. But the experience that I really wanted to share with you is I went to visit this older couple that lived in a trailer, and they had been divorced. And they lived together. And part of the reason is that Social Security would only give them 1.5 of his Social Security. But if they were divorced, he'd get all his Social Security and she'd get all her Social Security. Well, she'd get all so it'd be twice. And so it would increase their very, very, very low income by 25%, which was a lot. And I remember being there and asking them if I could use their bathroom. And as I'm walking down the hall, I noticed there were 2 bedrooms, and one of them was filled with junk, and the other one had a queen-size bed. Just saying. So I helped them to get a lot of benefits, not a lot of benefits. I mean, it's nothing, right? It's that $67 worth of SNAP, but I helped them to get benefits based on the situation that they presented to me about them being individuals who shared a living environment. Here's what I learned. If you really want to learn about somebody, go to their home I think we forget that sometimes. And a lot of times you have jobs where somebody comes into an office. It's very, it's not a good environment for trying to learn about what people's lives are like. Just as an example, if you go into somebody's home, you can see how many empty liquor bottles there are in the trash. How many people live there? But anyway, so that's one thing. And then regulations can be unfair. They really can be very unfair. So use confidentiality to your advantage. You're being told things, you know things. I certainly wasn't going to write on some form that they actually do live together. They are a couple, right? So sometimes it's okay. And I think this is one of those dirty little secrets of professionals. Yes, I did just tell you to bend the rules. Because sometimes the rules are unfair. And if the rules are unfair and you bend them and it's all confidential, I think it's okay. I think it's okay. And then hopefully you get to a position of power where you can change the rules, but some of these are federal laws, right? So I'm not going to change those kinds of regulations. Okay. I was also a community organizer for the Community Alliance. This picture, by the way, is a picture of the library where the little story I'm going to tell you took place. But I went to a community meeting. It was a library board, I think, and during the meeting, I was talking to them about something, but the library board was mostly older adults. I mean, yeah, greatest untapped resource. They show up. So anyway, I don't even remember what the topic was. I know that sounds bad, but whatever the topic was, I kept saying elders this and elders that in my little conversation. And this lovely woman was walking me out the door and she said, we do like to be called senior citizens. Mm-hmm. And the thing that I learned about from that is that language matters, right? Because I will tell you, I like the term older adults now. The American Psychological Society says that we're supposed to use the term older adult. Most older adults just want to be called, I don't know, adults. But language matters, and I think it's worth it to be as respectful. I told you I don't like the term elderly. I think it connotates a certain view of older adults that doesn't align with reality. And I think sometimes we have that problem when we're professionals in the field because we tend to interact with people that are struggling and can sometimes seem frail, particularly if you're like if you work in nursing. But most older adults are active and engaged. And so language matters. Call people what they want to be called, which is probably Mrs. Jones or Mr. Smith or, language matters. Okay. So I just have a few more for the sake of time because I got this active thing. So like drink your coffee now because I'm going to get you up and moving in a few minutes. But this is my husband and I just recently we were in Dublin. We have become that cute old couple. I don't know when that happened, but there we are. We're just such a cute old couple. So yeah, so I just have a few more. I left it this way because I figured I'd pay attention to time, which I have 6 minutes. So like, how am I going to consolidate another 20 years into 6 minutes? Well, I'm going to be concise because in the past, I probably would have started speaking really fast, but I'm not going to do that. All right. So I worked for the Vermont Department of Health. I became a government bureaucrat. My master's is in public administration. So I got a job working for the Vermont Department of Health doing prevention work and really got an opportunity to do some programmatic planning. And then I gave away a lot of grants for organizations to run different kinds of programs. So it was a good job, but one day I was sitting in my office and what I realized was that I worked with the people that worked with the people that worked with the people. And distance matters. Being that far away from the people was very problematic because I was making decisions and giving away money and designing programs, and I did not have my finger on the pulse of older adults anymore. And I wasn't one myself because I was in my 30s and 40s. So that was problematic. So that's why I thought, well, I got to change this. So I went back to school to get my master's in public administration. And I started interviewing older adults in their homes. My interest was rural older adults and the kinds of support networks they would develop for themselves as they needed help in later life. And when I discovered it, and my thesis advisor never quite got this, but if you really want to design some good programs and policies, sit in somebody's kitchen and talk to them about what their life is like. Don't read, well, don't read literature shit. I mean, I publish. You read the literature too, especially my stuff. No, but really listen to the people, right? Listen to the people that are going to be impacted by this. So that was one of the things that I learned. And then the last one was as a graduate student at Miami University getting my PhD in gerontology. And I just wanted to say I could have completed my entire PhD in gerontology without ever having talked to an older adult. I think that's a big problem in academia. But I sat in people's kitchens again, talked to them, because that was great. And the thing about that I learned from talking with them is that social supports matter. So back to the literature, there's a Harvard longitudinal study, and they say in the study that it is number one, social support. That when they looked at people in their 50s and then looked at them again when they were in their 70s, the most likely thing that was going to get them from their 50s to their 70s was a strong network of support. Not whether or not they smoked, not how much exercise, not their diet, not whether they had heart disease at 50, but how strong of a support network did they have? Wow, that was good. So I heard that from the people. Those that were more isolated were struggling more. I guess it makes sense. And by the way, I don't mean big, like having a big network. If there's not a single person that you can call up when you're struggling and be honest about that struggle, that's not a good network, right? You gotta have those good people, and you gotta have enough of them. And I will say right now in my support network, I have a lot of people who are in their 20s, and I love that. I love that lesson too, right? Because I talked to a woman in Appalachia in North Carolina, and she told me that everybody her age was already dead except for her, all of her friends and all of her family. So it's important that those support networks also include younger people as well. Okay, I'm doing good. This is me. In 1980, at the start of my career, who thought they should put me in charge of anything? Like, I just look up at that poor, naive young woman. I think, oh my gosh. Yeah, so long before I became part of a cute old couple. All right, so what are my lessons? I'm realizing that my little face is in the way. Let me get myself out of here. Okay. So we need to tap into the wisdom of older adults. This is the nice little summary. And as I was going through this process, I realized I have done that. So many of the things that I learned from my older adults over the years, so many of those things I have incorporated into my life. So I did that. I tapped into that untapped resource for myself. Wow. Next. I don't know why it doesn't want to advance. I had that problem earlier. Okay, keep your faith. Always keep your faith. I think that's such a great one. Thank you, Mrs. Washington. Okay, go where the people are rather than expecting them to come to you. True with somebody with dementia, true with going to visit people in their homes, if you can do it, right? Go where people are. Stop expecting them to come to us. Be an advocate rather than an activist. Let the older adult lead. Be flexible and use confidentiality to your advantage. Okay. Language matters. And if you don't know what term to use for a large group of people over the age of 60, use the term older adults. Even though there might be this old lady from the library that tells you we like to be called senior citizen. She likes to be called senior citizen, right? Yeah, so call her a senior citizen. Okay, and here's a few extras. Distance and direction matter. So involve the people, the communities, the individuals in directing both policies and programmatic decisions. And then social supports are the most important thing as we age. Okay, I think that might be my last slide. It is my last slide.